As the number of COVID cases has edged slightly upward over the past few weeks, the federal government is signing off on new COVID-19 vaccines.
This clears the way for drug manufacturers to start shipping the new shots to pharmacies and doctors' offices across the country.
News 8's Richard Allen is live in Kearny Mesa with more on what we're seeing here in San Diego County now and advice from a local doctor on who would benefit most from getting that vaccine. Richard.
Well, Carlo and Marcella, that's right. The FDA has now officially approved these new COVID vaccines for everyone 65 years or older, as well as those younger with an underlying health condition.
Since the COVID pandemic, we've had surges in the summer, and this year we didn't have the typical surge.
Dr. Ahmed Salem, a pulmonologist at Sharp Memorial Hospital, says that here in San Diego, we've not experienced the summer surge of COVID cases we've seen in years past. Last week, the county reported 550 confirmed cases of COVID, which is about half the number we saw at the same time last year.
I mean, we have seen some indications of COVID increase, but there is no evidence that there's a COVID surge at this time.
Dr. Salem served on the front lines of the COVID pandemic, with Sharp treating over 50% of all hospitalized cases in San Diego.
We were hit very hard, and I saw hundreds personally of people die, in the hundreds.
That's why he says it is so crucial that those at highest risk get the COVID vaccine, including those 65 and over.
And most of them were people who had comorbidities, who had morbid obesity, who had diabetes, who are immunocompromised, or were elderly. And if you are in that category, then we highly recommend you get the COVID vaccine.
For those not at high risk, the priority to get immunized is lower.
And the COVID vaccines don't necessarily prevent transmission. There's no evidence that they prevent transmission. So if you're not at risk, then the indication for taking the vaccine is not as high, because you're not preventing transmission.
These new vaccines were formulated by targeting a particular strain of COVID.
If we guess right, then the vaccine effectiveness is going to be higher. If we don't, then it will be lower. And remember, it's definitely an educated guess, but it's still a guess.
Many health professionals recommend getting both the COVID and flu vaccines in October for the best protection that lasts through the respiratory virus season. If you have sensitivity to vaccines, it's advisable to get them separately.
And if you're sick, please go seek medical attention so you can get the appropriate therapy so you can protect yourself, but others. And the vulnerable people in our families, we know them. We want to be extra careful with those people as well.
And drug manufacturer Pfizer has already said it plans to start sending out its new COVID vaccine immediately, while Moderna and Novavax are expected to start sending theirs out to doctors' offices and pharmacies in the next several days. Carla?